This workshop was a result of many years of planning, but the truth is the Academy has a very long history of bringing experts together to review the state of the science in periodontology, and they do that typically through workshop settings.
Periodontists have always been associated with regeneration around teeth, and now dental implants as well, but we have always established ourselves as the only specialty that handles periodontal regeneration. So we wanted to reaffirm that first and foremost.
Periodontal regeneration is all about our specialty. We do major foundational work. We grow bone, we grow gum tissue, we are the emerging technology. So this regeneration workshop encapsulates what a periodontist does as far as rebuilding foundations.
This conference, there were over 60 experts from across the continent and abroad throughout the world. And they were gathered to convene and create consensus on a variety of topics, including soft tissue root coverage procedures, the use of gingival augmentation around teeth, periodontal regeneration, both intrabony as well as furcation defects, and finally looking at the emerging technologies and materials that we have in the field of regeneration.
Each group was assigned a specific topic to review, and the leaders of the group prepared systematic reviews for each of the participants in that particular group to review and to make comments on and to evaluate the strength of the evidence.
What we wanted to do, like in any other workshop, would be to go through the literature and look at systematic reviews in the hierarchy of things and determine what is the evidence and what works best in regenerative therapy.
Well, when you take 60 experts from around the world, who are scientists, who are clinicians, who are academicians, you get your brightest and best, and you get a consensus on what is the state of the art.
It comes to being able to provide predictable algorithms, what materials work, what nuances in technique, etc. And I think that the conference tried to look at that as well. What is it that has evidence that should be used? What are things that are emerging technologies? We discussed about emerging technologies. They may not have evidence at this point, but certainly show promise. So I think that this is not just a static piece of information, but one that's somewhat dynamic, that hopes to be future focused and move us into the future treatment of our patients.
These things don't happen without a lot of help, and so we need to thank, number one, the American Academy of Periodontology Foundation, the Osteology Foundation, Geislich and Colgate, because these events don't happen without their support. So we thank them from the bottom of our hearts.